The female pelvis differs from the male pelvis in many ways, such as the size and shape of the bony pelvis, but also by internal viscera due to the presence of the uterus, the ovaries, and the superior vagina. This, of course, has implications for the layout of the pelvis, which must be understood for anyone studying anatomy and how it can be interpreted in medical imaging. Therefore, in this tutorial, we're going to be breaking down the different components of the female pelvis by comparing them in the following order. So first we're going to begin with the visible osteology of the pelvis, then the structures of the abdominal wall, which includes the muscles and the fascial layers, and then we'll move on to the pelvic viscera and associated structures and the vasculature. And finally, we'll discuss the clinical correlates towards the end of the tutorial. Before we continue with the tutorial, I'd like to introduce you to the illustration that we'll be using throughout. In this illustration, we're looking down into the pelvic cavity. The peritoneum that would normally form the roof has been removed to enable us to see the underlying structures. So first off, let's make sure that we understand the orientation of the image. So the top of the image is the anterior pelvis, the bottom is the posterior pelvis, and then we have the left and the right sides of the image. As mentioned before, we're going to start with the osteology of the pelvis, and this will allow us to build the anatomical structures onto this and give us a better appreciation of the view and the pelvis as a whole. So the first osteological components that we're going to be looking at is the sacrum. So here we can see the sacrum from the anterior view of the pelvis, and as you can see, it is an irregularly shaped bone. And although it looks like a single bone, the sacrum is actually made up of 5 fused vertebrae and links the spinal column to the iliac bones of the pelvis. So over here we see the sacrum from a posterior view, and it's a really good landmark to orientate yourself when looking at illustrations or medical images. Easily identifiable on its posterior aspect are its spinous processes and sacral canal. So going back to the superior view of the bony pelvis, we can see the triangular sacrum posteriorly articulated with the other bones of the pelvis. So the next bones articulate with the sacrum as we just saw, and these are the ilia or the iliac bones. And these broad bones make up a large portion of the bony pelvis, and it can be seen in green on the left covering the posterior part of the pelvis. On the right image, we can see the right ilium joining with the sacrum and also the femur sitting in the acetabulum, which the ilium contributes to. The final bones that we're going to mention are the pubic bones. These are also known simply as the pubis. So in this illustration on the left, you can see the pubic bone highlighted as seen from the superior view of the pelvis. And as you can see, only a small part of the pubis is visible from this perspective as it is covered by other structures. But on the right, we can appreciate that it completes the pelvic inlet anteriorly and unites in the midline via a cartilaginous joint known as the pubic symphysis. On the illustration that now appears on the right side of the screen, we can see the pubic symphysis as seen from the superior view of the pelvis, and in this illustration the urinary bladder has been retracted slightly to allow us a view of the structure from this perspective.